We're starting now.
Okay.
Yes, okay. Thank you so much for joining us from whatever part of the world. Good morning, good afternoon, good evening, because we have a lot of people who register from different parts of the world. And today we are discussing why IVF cycles may fail. This is the second part of this topic because we handled why IVF cycles may fail, part 1, a few weeks ago, and the response we got made it important for us to have a part 2. And this is a topic I handle with the utmost responsibility, as it's a very emotional one, especially in a country like yours, like Nigeria, where patients do not only have to deal with the financial ordeal, but also the emotional ones. It's like a double whammy in this part of the world. It's a known fact that most people pay out of pocket to do IVF in Nigeria and probably all over Africa. For today's discussion, I'm going to lean heavily on data from the United Kingdom, where they have a very active regulatory body, as well as data from other parts of the world like America and Australia. In Nigeria, we also have a budding organization called the Association for Fertility and Reproductive Health that is trying to see how we can regulate and keep data on IVF in the country. But it's still, trust me, it's still a young organization, and we're doing everything to make it be able to stand. Today is not going to be a monologue, as I have with me today to share their experience with IVF, Mr. and Mrs. Oladuni. This couple continue to amaze me. They've been through the emotional roller coaster of IVF, and they're so gracious to share their journey with us. I'm going to invite them to in a few minutes. Well, one thing I want us to get from this kind of forum is that it should help us to understand the technology of IVF. That is, what to expect from IVF. What can IVF deliver and what can it not? And also to help us to dispel myths and misconceptions. As we go on, I'm going to explain why IVF fails. But I'll start by quoting from like I said, I'm going to rely heavily on data from the United Kingdom. On the Human Fertilization and Embryology Authority website, I'm going to quote this from their website. And they say IVF is one of the most invasive and expensive treatments for infertility. They also said it is also one of the most successful treatment depending on your circumstances. And I want us to note that it depends on your circumstances. So, because most of the time we'll go on, we'll see that sometimes we want to blame somebody. And what I try to say sometimes that couple A, the chance might be different from couple B, because it depends on what we're dealing with in each couple. But they also said that it's a lot to go through. So you need to get the right support when you are going through this treatment. And I'm sure that's one of the things we are going to learn from the Oladunis today again. But also, let me just I like figures, because nothing tells stories better than figures. And so I'm going to also the website of the National Health Services of the United Kingdom also. And they said when you're doing IVF, that the success rate, if you are less than 35 years old, is about 29%, using your eggs, of course. If you are between 35 and 37, it's about 23%. If you are between 38 and 39, it's about 15%. If you are between 40 to 42, it's about 9%. If you are between 43 to 44, it's about 3%. And when you are more than 44, it's about 2% using your eggs. So that is, at this point, I'm going to invite Mr. and Mrs. Oladuni to join us. And what I'm going to ask them to do, but maybe let's meet them first. Mr. and Mrs. Oladuni, please do welcome and introduce yourself first, so that before I say you share your story with us.
Good afternoon, everyone. I'm Oladuni Musbao. With me here is my wife, Jumoke Oladuni.
Great. It's a pleasure to meet with you again now. I know you very well. So yes, please tell us a little bit about your story.
I think I'll do that.
Yes.
Yes. Because I think I started IVF in 2012, and I've had like 10 cycles done so far. Then I think I was still very young. I was at the age of 30, probably 34, 36 then. 34, yes, then, when I joined the Nordica facility. It's a very, very devastating. There has been successful story and there has been the other side of it. At the beginning, when I joined Nordica, I think we actually paid for 3 circles at stretch. Now, okay, so let's try 3 circles. If this doesn't work, the other one will work. But along the line, a lot of things came up. I had fibroid. I had to deal with that first. I had blocked tubes. I had to deal with that too. So after unblocking the tube, because I insisted my tube should not be removed, though I was informed then that if they unblock the tube, it might lead to ectopic if I try another IVF. But I was so adamant, and then I said, no, I still want my tube. And I went ahead with another IVF. Fortunately, I had a successful one, but it ended up being an ectopic one. So I had to go through another surgery. So it's not been easy. Anyway, it's not been easy for me. It's not been easy for my husband too. But I think sometime in 2015, and what I'm still, I think I've had like 6. I did another one after the ectopic again. It didn't work. A lot of things, as I was doing it, the doctors and everything would still come, okay, let's try this. I think while I was doing the last one, I was introduced to acupuncture. I was introduced to so many. I had to reduce my weight because I believed then that probably my weight was part of the reasons why those things were failing. I had to reduce what I googled a lot. Then I really, really googled that. What can be the possible, why is this thing failing? But I wasn't getting it. I've had like 3 and I've had a successful one. So why am I not getting the positive results? I had to Google a lot of things. They will tell you, eat this, eat that. After trying, it doesn't work. I think I tried acupuncture along the line with another treatment. And then I had good eggs. I was having a very good eggs. The quality of the eggs were very good then. And we had a successful one in 2015. But after 2015, I now relaxed. If I had known then, I would have come back immediately because age was still on my side. So I didn't know age was still on my side. So I now relaxed. Not really relaxed, but you know, IVF is very, very expensive. And the money involved is, if I can calculate, it's not a small money. That is it. So now that I went, because I just had one recently, and it failed again, sometime in September. But then before I had that, I was told, Madam, you are 43 now. And the moment you are 43, the quality of your eggs, it matters a lot. I still went ahead. I was like, okay, let me still try. Let me give it a try. And let me go ahead and do it. It's fine. I have a grade C embryo. I was like, fine, it can still work. Since there's A, B, because I've got there's grade A, there's grade B, there's C and D, I guess. If I'm right, Dr. Ajayi. Yes. So yeah. I went ahead, but unfortunately, it came out positive, negative. And since then I've been wondering that what is the possible, why is it failing again? At least I've had 2 successful history with IVF, and why is it failing at this stage? So I'm good. I'm so happy we are discussing about this topic now. Thank you.
Yes, thank you so very much, Mrs. Oladuni. Mr. Oladuni, do you have anything you want to add to this?
What I can add is that experience with IVF is very emotional, especially in this part of the world. Because the first cycle we had, when the result came out negative, I was so furious. I could remember the day the doctor was relaying the news to us in his office. I had to bang his table. And he now told me it's not anybody's fault that it failed. Implantation is what nobody can explain, according to him. And at that point, that message sank in because I was able to compare it with the normal way of sexual intercourse. And then I started relating with it that, okay, how many times do you meet with your wife before you get a result? Maybe probably when you are trying to have a child, you have intercourse with your wife almost every day, and maybe it's only one that will be successful. So if the even natural way does not bring out such success, why then should I be disappointed that a cycle of IVF failed? So that was how I was able to manage myself psychologically. Then I went back and prepared my mind for it. The only part that was difficult was that the financial aspect of it, because like I tell people, it's not cheap. It's not cheap. It's just that when you get the result that comes out, when it's positive, it tends to help you forget everything you've gone through. So that's basically it.
Thank you so very much. Yeah, that's one thing that I say that, well, you may not know I'm a secret admirer of the two of you because of the way you have carried yourself through all this. I know it is not easy, you know. And you raised some things that I want, maybe if you can shed more light on some of these things. Maybe the first question I'll ask you, which is what I've been asking myself, why did you agree to do this program?
When they first told me about, I was like, I think I'm in the best position to share my experience. I actually want to share my experience with people. Let them really gain from what IVF is all about. You don't have to wait years sitting at home trying naturally. First, determine the cause why you are not. First, have to get to know why you are not getting pregnant. And the moment you are home for years or 6 months, try as much as possible to visit the facility hospital and start your IVF treatment. You don't have to wait till it will happen naturally. So it's just an opportunity for me to talk to people, share my experience with them, what I've gone through, because I know some people, they've gone through IVF once or twice and tell you, I'm not doing IVF again, it's not working. But I'm here to tell them IVF actually works, but you have to have that time and patience for it to work.
Wonderful. Yes.
In addition to that, I have found out that most people, even when they get pregnant via IVF, they tend to want to hide the information, especially our religious leaders, like the pastors and the alphas. Most times when they go through period of barrenness, what they eventually turn to is IVF, but they rarely want to speak about it. And for me, it's not a stigma. It's nothing. It's a medical condition. Once you have a medical condition, it's there. And once you can find a solution to it, I believe you should share your experience with other people so that you can help people negotiate that same curve better. Instead of trying to tell people that it's God. Yes, it's God, because the implantation itself is God. Even when the transfer is done, it takes the place of God for the embryo to implant. So it is still natural at that stage. And we have a child who is wonderful. She's not different from any other brilliant child you have out there. So why can't we share the story with other people so that they can learn from us? The first time we were introduced to IVF was over 17 years ago, but we refused. We refused to do it. We refused. We were believing in God. Yes, we still believe in God, but we had a medical condition that we should have attended to. But with our mental or our religious beliefs that yes, God will do it. Yes, God has done it, and it is God that gave people the knowledge to come about IVF. When people understand it from that angle, they will know that what they are going through is actually also a natural process ordained by God, because the knowledge to do it came from God. If we had taken that advice 17 years ago, it would have been a lot easier, because we got to know that age plays a vital role in success rate of IVF. So if we had listened 17 years ago, instead of trying to do it naturally, when we already had a medical condition that we were aware of. So that's why we are always eager to share our story anywhere we go to, even when people don't ask us. When we know somebody is already married and they don't have a child, we call them up and talk to them. We tell them, Mr. Man, God is everywhere. IVF belongs to God too. Don't live in, don't go to afar forever and expect that you get results. Find out what is wrong with you, know what your medical condition is, and then find a solution to it.
Dr. Ajayi, to chip in on a good thing. In addition to what he said, immediately I had this failed circle in September. I had to call my friends abroad. I know they are above 40. Friend, what are you doing? You cannot conceive naturally again. But this is what is happening, this is what's happening. I would prefer you probably start thinking of a donor egg now. I'm even the one advising them because I've googled and read a lot of things about age and IVF. So a lot of my friends that have been said, come, we need to start. Are you married? Are you not married? You have to start doing something. There's no way you can conceive naturally again without going through IVF now at this age. Yes. Thank you.
Wonderful. Thank you so much. Yes, you see, as we were talking, I was writing a few things down because I learned a lot from people. I picked up that you said it's a medical condition. Age plays a vital role. And then when Mr. Oladuni was talking, he compared it to intercourse. This is the first time I'm hearing somebody comparing IVF to intercourse. You know, I mean a patient comparing IVF to intercourse. It shows me a level of knowledge that you guys have been able to acquire, because really and truly, that is what we should compare it to. What is the chance of a woman conceiving per month when she has intercourse with her husband? Because that is what IVF does in a cycle. But majority of the time, nobody gives IVF that kind of chance. Maybe one thing that people have not even realized is that it was your 8th attempt that you had your baby. So I must let people know, I mean, when they see success, when people see success, they just think it just happened. They don't know what people had to go through sometimes in order to be successful. There's some people who have done only 4 cycles and they've had 4 babies in this clinic as well. But you know, there's some people who, and there was a big study done in Australia that showed about 30% of people don't have their babies because they don't do enough. So imagine that you are stopped on number 6. Do you understand? So, and that's what we see now, that people don't, because people don't understand how it works. I'm coming back to you, Mrs. Oladuni. You also said a few things that I want us to highlight. You talked about you had to reduce weight. This is one of the greatest problems that we have with patients. And actually, we tell some of them to go and reduce weight. By the time they come back, they put on more. And so they tell you that, look, I mean, this is who I am. I can't just lose weight. And that's not true. It's just not true. There are some people, I'm going to try to share why IVF fails in a few minutes. There's some people, they're smoking. And you ask them to stop smoking. They never get that discipline to stop smoking. Because you see, if you want something, you have to know what you have to give for it in order for you to get it. What people don't understand is that, and that's what I pointed out, what they said on that website, that depends on your circumstances. What determines the success rate of IVF is the quality of the sperm and the quality of the eggs. If the lab is working well, that is the other thing that is the responsibility of the consumer, to make sure that they go to centers where the labs are working well, where they have the pedigree, you know. Because I'm also going to, and then you said you did acupuncture. I know I've had a discussion many years ago with you about acupuncture, and you said, look, you could swear by acupuncture, and I said, okay, fine. But yeah, these are some of the things also that might be necessary for some people to do, you know. But I have a question for you.
Okay.
You see, also, most of the time it's on Nigerian for you to stay in one clinic and do about 8 cycles in one clinic. And that's what seriously amazes me about you guys. That I've had a few patients like that who they just say, you know what, we're here and this is where we're going to have a baby. And that places a lot of responsibility on me also when I see such people that, okay. Because the normal Nigerian walks from one clinic to another. Why did you stay with us for that long? And why are you even still with us?
Yeah, basically because of customer service. Honestly, whenever we come to Nordica, I always have the feeling that it's going to work. Because the environment tells me it's going to work. The people there make me believe it's going to work. So it's just a place that once I get there, I have this conviction that it's going to work. And because already I've zeroed my mind to the fact that the best Nordica or any other clinic can do is to transfer quality embryo. The process from that point is beyond them. And because I've seen the environment and I've come to trust that these people at Nordica would do their best to transfer quality embryo based on what we are able to produce, then I believe beyond that level, it is no longer Nordica. It is God. And that is, and it's not as if Dr. Ajayi, it's not as if we did not try another place.
Okay.
We did the first 4. We did the first 4 with Nordica. We had ectopic. After the ectopic, we had another one. That one was not successful. We now went to another place.
Don't mention any name. It's only Nordica that I want, so that we're not demarcating anybody. Yeah.
We went to another place. The moment we got to that place, I told my wife, I said, this environment is not it. It's not about whether it's going to be successful or not. Even if it's successful, I don't like this environment. Because the environment was hostile. The people there were hostile. So I was just not okay with it. After that experience with them, I had to just tell her, please, let's go back to Nordica. Even if it's not successful, what I get from the people around there, the environment alone is welcoming, the people are professional, their approach is, I'm okay with it. Let me go and be spending my money there where I get those other values. So that's why we have remained with Nordica. And one other thing is, each time we go to Nordica and we stay away for like 2 months or some months and come back again, you see something new there. You see something different there. You see an improvement there. So I tell myself, these people on their own too, they are not sitting on their past glories. They are trying to make progress. And once you find an environment like that, the best you can do for yourself is just to relax your mind. Any place that, because we've been told that a lot of this thing has to do with emotions and your state of mind. So if you have found yourself in an environment where where the environment helps you to relax, you can pour your mind, you can, like the last time I requested to speak with you, and it was made possible. They told me they were going to pass the message to you. I said, no, I want to talk to him by myself. I want us to talk. And I could remember the last time we had that ectopic pregnancy, we had a meeting. Maybe you have forgotten. We had a meeting. And it was at that meeting you did a calculation for us. You said we've done 6 cycles. The first 3 were not successful. The 4th one was successful. But it turned out to be ectopic. You now said, okay, let's be mathematical in this thing. Now you have done 2 that are not successful. Let's use the 4 as our benchmark. That let's do another 2. You now offered that we should pay for 1. And then if it's not successful, you will do the second one free of charge. It was an offer you made on your own. We did not request for it. And we went through it and it was successful. So it was like a formula for us. 1 out of 4. 1 out of 4. So that was part of what kept us with Nordica. Because of, honestly, it's the people in Nordica.
To add one of good things to what he said, most times when we come to medical, before we get home, especially when it doesn't work, when we have our normal doctor calling us this negative states, before you get home, there's always this message that comes into my phone, like a prayer message that please don't worry, so this, and that's enough. Gives me that hope to keep on. That definitely God will do it one day.
And then the people there will keep calling.
They will keep calling.
They will keep calling
checking up on
from Mrs. Ajayi. She will call and discuss several other things that are not even related to the IVF, and that helps you to relax. It creates an environment for you where you feel that you are wanted, because everybody wants to remain where he or she is valued, even if you are nothing, and people carry you. That's basically why we have remained with Nordica.
You know, this is, I must tell you that you are peculiar. This is not the normal thing you get in Nigeria. You just get, somebody just does one cycle and is not successful. Come and see Facebook, come and attack on, as if, you know, sometimes it makes me to feel that, okay, are we actually, do we understand this technology? You understand? You know, that's why I loved when you said you compared it to intercourse. And like I said, that's the first time I'm hearing this patient saying that you compare it. And, you know, that's why I said, any question I'm going to ask you, I want it to come from your heart. So it's not as if I've shared any question with you. I wanted it to come from your heart, because you just supplied me with some answers that I've been asking myself some questions about you. That what is keeping these guys going? That how are they doing this? You know, but you have just given me so many answers that also I need to, I'm going to ruminate on. Now, I'm going to also ask you another question. Yes, because we have done in total about 10 cycles now. How did you raise the money for this? Because this is a lot of investment. Let us face it.
You know, when there is this thing about life, I don't know. I shared something with you the last time we had a meeting.
Yeah.
And I told you it's the irony of life. I don't know how to explain it. When we were going through the cycle, I was making money. So to pay for it wasn't difficult. When we decided not to, when I started saying, okay, well, no money to go back, no money to go back, and truly there was no money. And the money was just not coming. And when I now decided that we are not getting younger, let's try once more, I was surprised how I was able to raise the money to do it again. Fine, let me, because you know I don't like talking about money and saying it was grace of God. Because I know that a lot of people do a lot of evil things in the name of God than even in the name of the devil. So when I want to explain to people how I get money, I try to be a little open and say it exactly the way it is. I'm into petroleum product business. I run filling stations. I have about 3 to 4 outlets where we sell petroleum products. So when we're having the IVF, during that cycle, there was a boom in the market. It was the era of the previous government, and there were so many ways for let me give you an example. During fuel scarcity, under the previous administration, you could sell at your station at any price. Under this new government, even when there is scarcity, you dare not sell at a price that they will come after you. So those things were there. So it was the government that allowed for some leeway to do your business.
Yeah.
Business there was a boom in the oil business. during that period. But now, even the global economy now is slow generally, not even about any government or anything. Globally, the economy is slow. So thank God, while we were doing it then, there was boom in our business, and we didn't feel it. And the fact that we got a result, which is a wonderful result, a girl that is more than 1 million. So it gives me the courage to even come back to Nordica. I've told my wife it has to be Nordica, because what am I looking for? I know that they will transfer it, and it's not their job to implant it. So what am I looking for elsewhere? Theirs is to transfer, which they will do, and they will do to the best of their ability. So that's it.
Thank you for the trust. But now I have one more question for you, and that is like a personal question. It's not always that you see couples go through infertility that they remain as close as you guys are. How have you managed?
Should I say it's God?
I don't always like to say just God.
No. Tell us exactly.
I think it's, to me, like you said, it doesn't like saying God, but to me, I believe it's God. And the faith, I think we built things right from the day one. It's what we built along the line, and everything. We believe that trust has been there. So I think it's that trust that is still keeping us moving on.
Dr. Ajayi, let me from my side, we've been together since secondary school.
Yeah. Since 92.
We attended the same secondary school. And we've been together since then. And what led to this situation is one thing I want people to even learn from. It's not as if she's not been pregnant before, naturally. She's been pregnant before, naturally, and we decided to get rid of it because we thought we were not ready. Even when we were in university, she was pregnant again, and we decided to get rid of it because we thought we were not ready. So when we came out of university and we finally got married and felt we were ready, it was not coming. So we had to go for normal medical checkup and the rest. And we were told that she's got a blocked tube. So I asked the question, what could be responsible for it? They now gave us several reasons. One was abortion that was not properly done. At that point, I knew that was the reason. And I said to myself that we are in this together. Because for us, we have always been in things together. It has always been, if anything happens, we are in it together. If anything happens, we are in it together. If anything happens, we are in it together. It's not as if I'm the best of husband or the best behaved person. It's just that when anything happens, we tell ourselves we are in it together, and we move on. And because for me, I always try to analyze things objectively.
Yeah.
I always try to analyze things objectively. I don't like blaming anybody for anything. I just want to understand the reasons for it. Then from that point, I can deal with it. Once I understand the reasons, I can deal with it. So the moment I knew that was it, and I know of many people who are married. I know of a friend who married a virgin, and they still struggled for like 10 years before they could have a child. So if that could happen to them, so it's not a question of, and I know of somebody who had several abortions and got married immediately. She has like 4 kids. So for me, it was not about what we did. It's just that we have found ourselves in a situation, and it was time to deal with the situation. And thank God there was IVF. So I told myself, said, God, I'm at this point to show me that you are forgiving me of my sins. Bless me so that I can pay for this thing. And each time I go, He blesses me. I spend 1 point something million. I always have more than that money within that period. I always have more than that within that period. The period I said I was not doing IVF because the economy was down, I was also down too with the economy. So to me, economy is no longer down. So I'm moving on.
Wow. Some people are praying for you. They're praying for you. Seriously, I think this way of looking at life is not everybody who has it. You know, I've seen so many people in my life now that I know that some people are just blessed by the way their perception of life, you know. And when you have that kind of perception, you know what? Ways open for you. There's just no two ways about it. You know, ways just open for you. I'm not going to try to preach, but I'm really very, I would say I'm happy and even privileged to have known you guys. You know, because when I see people who have gone through things together and they stay together, you know what? I really appreciate them. And I've never heard your story before, you know. But I've heard bits and pieces, but I've not heard from the beginning. So, yeah, some people are saying a lot of good things about you. You both are sincere. God bless your home. You stood by her all through, knowing it was a joint decision from the beginning. I'm dazed. Thank you, Mr. and Mrs. Oladunni, for sharing your experiences. You are indeed a blessed man. Men like you are very few. You know, that's, yeah. Thank you, Mr. Oladunni, for not leaving your wife to go through all the circumstances alone. You are indeed a man. So there's so many things that people are saying that, and I also join them. It's still coming. It's just coming and coming. And Mr. Oladunni, the man you be, God bless you for staying true. You know, wonderful. It's a wonderful experience. It's a wonderful testimony, and I will see how would also the God help us that we can probably do more. Maybe your daughter will have an aburo. By the grace of God, yes.
I would like to ask a question. Is it
Sure.
Yeah. Is there any supplement at the age of 40 that one can use to actually boost the ovary at the ovarian reserve?
Okay, you know what? Let me finish my presentation and then you can ask that question again. Okay. My presentation is very short, maybe 10 minutes, and then if you want to ask that question again, then you can ask. Because so many people, I have a lot of questions and so many, it's all in that direction.
Yeah.
Yeah, people want to reverse age. Unfortunately, it's the only thing that we can't reverse. You can't be 29 today and be 28 tomorrow. God has not made that possible yet. So I'll just go through this presentation, and then if you still have you are going to stay on. So if you still have the question that you want to ask, of course, you will have a number one position. So yes, so just give me about 10 minutes to go through this, and then I will come back if you still have any questions. So I'm going to start my presentation with, like I said, I was going to rely so much on the figures from the UK. The last week of June 2020, the HFEA released the figures for 2018, the IVF success rate in the UK. And they said the average birth rate per embryo transfer in the UK in 2018 was 23%. If you are less than 35, the chance that you take a baby home is about 31%. If you are 35 to 37, 28, 25%. 38 to 39, 19%, 40 to 42, 11%, 43 or above, 5%. And it's based on that, you know, they have this National Institute for Health and Care Excellence in the UK that recommends that you should not do less than 3 cycles because you have about 45 to 53% chance of carrying your baby home. The $1 million question people are always asking me is, Why does IVF fail? I think Mr. Oladuni has answered it today, but I'm going to try to expatiate a little bit more. Why does IVF fail? Now, for us to do that, let's go back to the basics. Reproduction has two parts. The first part is the fertilization, where the sperm and the eggs come together. Now, the quality of the sperm and the quality of the egg will determine the resultant embryo, okay? And in the embryo, we need the embryo now to implant into the endometrium of the uterus. So that's the second phase of reproduction is implantation. So the two phases, fertilization, implantation. Now in IVF, which is fertilization taking place outside the body, when the lab is working, we usually have about 75, well, let's say 70 to 80% fertilization rate in the laboratory. But you see the figures that we've been showing. Where the rubber meets the road most of the time is this process that we call implantation. That's where most of the failures take place. Just like Mr. Oladuni said, that the only thing the doctor can do is to deliver good quality embryos into the uterus. Now, from that point on, it's like 4 plants, Apollo waters. It's only God that can give the increase. And I always like to compare it to when you have planted like maize, all right? And then you until it sprouts, you don't know whether it has grown or it has not grown. So we say that most of the time, the failure comes from implantation in IVF. But what is involved with implantation? Two things. The embryo, the endometrium, all right? The endometrium is the lining of the uterus, all right? So those are the two things involved with implantation. Now, the uterus or the endometrium, we need to see that it is uniform. And so we sometimes do a test, which the water scan, which we use as a screening test, and then we can do a hysteroscopy. Because sometimes I see some patients saying that I was made to do an unnecessary hysteroscopy. It's because you do not know hysteroscopy is not unnecessary, because no matter how good the quality of the embryo is, if the endometrium is not uniform, then whatever we put there is a bloody waste of time. And so that's why sometimes especially when you are above 35, when you have done a previous surgery, we want to be sure that your uterus is still regular, because but that is just the way, the structure, not the function of the endometrium. So we can assess the structure of the endometrium, but there are some tests that we are not going to mention about today, which we can use to also look at the function, but we don't do the function for everybody. All we just want to be sure is that the endometrium is regular enough to be able to take the embryo. Now, this is where the problem now comes. The embryo itself, when the sperm and the egg have come together, they form an embryo. Now, when we qualify the embryo, we say we need good quality, genetically normal embryo. So we are not just looking for embryos. We're looking for, one, it must be good quality, but it must also be genetically normal. And that is where the problem now comes in. When the sperm or the egg are not of very good quality, sometimes because they are not genetically normal embryos. So you see sometimes the patient comes to us and says that, oh, but the embryologist said my embryos were grade A. I say, yes, it's true. But what does that mean? The embryologist is just telling you about the quality of the embryo, but not the genetic, is not genetically normal. The embryologist can never know whether the embryo is genetically normal by just looking at it. He can only tell you whether it's of good quality, but the genetics, the embryologist cannot tell you by mere looking. If we are going to do that, there is a specific test that we can do for that, which we don't do routinely for everybody, but I think I'm going to mention it as time goes on. Now, where do we have this problem with implantation? It's because of the process of development of the embryo. You know, when the egg and the sperm first join together and fertilization occurs, then the embryo starts to divide from 2 cell to 4 cell to 8 cell. Sometimes during this period, that's where the problem comes in, and we have abnormal number of chromosomes in the embryo. So that is what we call aneuploidy. And this is we have seen that this is the greatest problem that makes for embryos not to take, for implantation to fail, or sometimes after implantation has even succeeded, for there to be a miscarriage, because it is the body's way of discovering embryos that are not normal. And that is why we say that babies from IVF are normal babies, because they go through the same process that embryos that result from the bed also go through. So this is the quality control system in the body. So once there is an impurity in the embryo, the body rejects it. And some people did this study where they looked about looking at the 5 embryos. The 96 centers were involved, over 3,500 cycles were involved, and they had over 19,000 blastocysts that they analyzed. And they looked at it from the age, because we just like also when Mr. Oladuni was talking, he said they've seen that age plays an important factor in reproduction and in IVF success. Now, these people were able to look at this and say, look, if you are less than 35, 30% of your embryos cannot become babies. The 5 embryos cannot become babies because they have this abnormal number of chromosomes. But if the same person is 35 to 37, it's about 40-something% that cannot become babies. So you can imagine if you have 10 embryos from the 35 to 37, what he's saying is that about 4 out of the 10 cannot become babies. So, but if it is a 38 to 40-year-old, about 60% cannot become babies because of this problem with the embryos. Now, if the same person is between 41 and 42, is about 80% that cannot become babies. So in other words, if a 41 or to 42-year-old has 10 embryos, it's only about 2 that can become babies. And this is why sometimes we ask patients who are in that age group to use donor eggs, because donor eggs bring you back to the success rate of the age of the donor. So how do we increase your odds? Because especially for people over 35, one of the things that we say to people is that if you need IVF, just like you heard during the testimonial too, that if they are started 17 years ago, no procrastination. If you need IVF, please start early, because your success rate is better when you are younger. If you are not starting IVF right, or you don't have a husband yet, you could freeze your eggs. So, and that is possible also. You have to choose your clinics. And then again, sometimes when you are older, you might need to do multiple cycles, maybe 2-3 cycles before you have one transfer. This increases the number of genetically normal embryos. Don't forget what I said. If you want to have a success, then you need to have enough number of genetically normal embryos. So this increases the number of, for example, let's say you are 40 and you're able to have 10 embryos from maybe 2 cycles or 3 cycles. Then you can be sure that out of the 10, maybe 2 or 3 can become babies, you know? So that increases your chances, rather than when you are 40 and you have only from 1 cycle, maybe you have 4 embryos, and we know that it's only 1 or none of them can become babies. So the other test that you could do is testing for viability. That can increase that, but that is a very expensive test to do now. It's like the iPhone of IVF, you know. It's because anything that, you know, technology, IVF is technology. And that's why when people start phoning around looking for the cheapest, I'm not saying the most expensive is the best, but also the cheapest can never be the best. You know, it's like when we talk about iPhone and the other phone, I don't know what so, you know, there's some other phones around, but when you are buying iPhone, you know that, of course, you are buying premium. So IVF is technology, and it's not, we don't make anything in this part of the world. So you must be careful when it's too cheap. You might be in for a long thing. So testing for viability, that is also possible. We do PGD, especially for older women. And of course, people who are looking for a particular gender also might be able to do that. And then for people also who don't want to transmit one disease that is genetically transmissible to another, for example, sickle cell. But also one thing that we also need to emphasize here is the importance of lifestyle, you know, and that's what I loved it when Ms. Oladuni said she had to lose weight. Losing weight is very, very important in IVF. You must be of the ideal body mass index. When your body mass index is over 30, then your success rate reduces. Like today, because I fix all the dosage for all my patients, whether they're in Asaba, whether in Abuja, I have to come across their case note. I have to see what they're doing. And I see a patient whose weight is 30, the BMI is 38. Of course, that is already problematic. You see people who are smoking, and they can't even give us smoking for their treatment. Then it's problematic. There is no magic that the doctor can do. Excessive caffeine is not good for when you're doing IVF. Alcohol, excessive alcohol is also not good when you're doing IVF. And then you might have to use some ancillary services like, of course, psychotherapy. Counseling is important. Unfortunately, Nigerians, the uptake of counseling in Nigeria is not so much. And people also, they think it's church counseling, religious counseling. You know, the pastors and the imams they know everything. Even the ones that cannot get married, they're advising people on how to get married, how to behave in a married environment. You know, so in counseling is not supposed to be to advise you. Counseling is supposed to listen to you and help you to generate the solution to the problem that you have, because you are the one who actually knows what the problem is. So the counselor just helps you to generate possible solution to the problem. So it's also something that we need to continue to look at. Acupuncture, just like Mrs. Oladuni said, might just be important or can be helpful, because we know that we decrease stress level, we help you to relax, and so on and so forth. And then there's some add-ons also, which I'm not going to talk about today, that other people have said might help in IVF. One thing I want to leave you with is that no responsible IVF clinic can tell you that I guarantee you success. The only thing we can do is we can work with you to achieve success. Okay? We can, and that is when you have to play your own part, make the right decisions. I see so many 48 years old coming to me and they say, I'm going to use my eggs. Come on. It's not, you have seen from the figures, these figures are not from me. They are from the UK, the regulatory body of the UK. So if you're going to use your eggs when you're more than 43, you know that it's like making the cups to work. But what we can guarantee is safety. And that is, if you are choosing your IVF clinic, these are the things I want you to look at. Safety. That is the most important thing you should be looking for. Sincerity. With these people, are they ethical enough to tell you the truth? Okay? And then, of course, confidentiality. And those are the things I think we can guarantee. And then, Mrs. Oladuni, you have the ringside position. If you have any questions, you can ask. And then if any other person has any questions, they can ask.
Actually, I want to ask if AMH has any effect on, that's the Omilerian hormone.
Yeah.
At the age of 40, does it have any effect on IVF?
Wonderful question. Okay, AMH, FSH, they do the same thing. They measure the chances that you are going to produce eggs. Okay, AMH is supposed to be more accurate than FSH. Okay, but you know what I say to people all the time? In IVF, it is not eggs that you are looking for. It is why you are doing IVF is because of babies. We have seen why the eggs, even when you have them, might not become babies. And so the age is probably more important than your AMH or AFSH in determining the outcome of why you are doing IVF. Does that answer your question?
Yes, sir. Yes, sir. Thank you so much.
Yeah. Great. Okay. Okay, thank you so much. Some people are still praying for you. They say you are indeed a blessing to humankind. Whether that is you, whether it's me, I don't know, but the two of us, I'm sure. Then, okay, somebody's asking, thank you. What's the process of freezing my eggs? I'm now 35 and I have one child, but I'm not ready for another pregnancy on the 3 to 5 years or 4 years. Okay, fine. For you to freeze your eggs, you have to do IVF. And it's after you have done IVF that we can now freeze the eggs. But the other thing I must tell you about freezing eggs, which was a big problem initially, is that many people who freeze eggs are not freezing enough. For you to freeze your eggs, you need, and for it to, because don't forget, each time I always remind people that why you're doing IVF is because you want to have a baby. For you to have the chance of having a baby, you need to store about 15 matured eggs. So, and that we need to remember that. So, egg freezing, you have to do IVF, but you might need to do 1 or 2 cycles before you have enough eggs to store in order for you to be able to have the necessary baby that you want to have. Then somebody's asking, are there any side effects on babies gotten through IVF? I think Mr. and Mrs. Oladuni will answer that. Whether the babies born from IVF are different from normal babies.
I can only talk about my own experience with my daughter because I'm not.
That's enough. That is enough.
She's wonderful, very smart, intelligent. She's everything you can ask for a child. So I don't see anything, and she looks exactly like me. So I don't see nothing that I know of. Nothing.
I'm glad to hear that. Well, some people are raising their hands. Why don't you just type your questions so that we can read them? Because sometimes if your internet connection is not very good, it can mess everything up. So if you type your questions, I'm going to read your questions so that we can treat it. Because Mrs. Abose Deomodu says she's raising her hands, but please type your questions and then please, is there a way of smoothing out a womb with additions due to mammectomy? Yes, that's why we do hysteroscopy. Unfortunately, sometimes you might need to repeat more than once. And sometimes also, because the additions are so bad, we might have to tell some people to do surrogacy, because sometimes especially when you had repeated mammectomies, and that's why one of the things we're saying now that be careful, we just don't continue to have repeat mammectomies, because sometimes the additions become so strong that it's difficult to break it down. After a successful IVF process, how soon can you have another one, especially if you are 48 years old? Well, how soon you can have another IVF usually depends on you, because we know that you have to breastfeed, and then we don't advise, just like you space your family also when you have natural conception. So you can do it maybe 1 or 2 years after that.
I have a question here.
Sure, please go on.
Is there any food or fruits one needs to avoid during the embryo? You're laughing. To avoid after embryo transfer.
Yes, you know why I'm laughing is this, because when it comes to things like food, okay, it's a difficult answer, because you see most of the studies on food are not control studies. So you see today, it's just like weight loss. Today, somebody will come out and say, oatmeal is best. Tomorrow, another person will come out and say, oatmeal, if you touch it, you are not going to lose weight. So food is usually very difficult. I know a lot of people talk about pineapples and so on. But as long as they're not dangerous things, I don't mind. But I'm not going to say bet on it. But I mean, do other things and then eat a lot of pineapples if you like. That's okay by me. But I also know so many people who have not eaten pineapples who have had babies. So for food, I'm a little bit careful. Yeah. Somebody is asking, how can I improve my chances? Now I'm 41 years old. Well, we've said that. We've also showed you why age affects the chances of IVF. And so you cannot really improve your chances. But you can do some things. We have talked about lifestyle. Okay, the ones that are in your control are the lifestyle issues. But aneuploidy is not within your control. When the embryos, the chromosomes they make mistakes. That is not within your control. It's an age-related thing. So you can't do anything about that, but you can reduce caffeine, you can have your ideal body weight, no smoking, no alcohol, those can help you. But that will just maximize the success rate for your age. Immediately after my IVF, I added a lot of weight. And there is this unconfirmed report from the series of hormonal taking during the treatment. Is there anything one can do to clear out the excess hormones after treatment? Seriously, the drugs that we use in IVF are your natural hormones. Okay, they're just given in a higher dosage. So, and that's why you can see your menses after a failed cycle, because your body has gotten rid of them. So, but of course, what might happen is that there's some of them that might have water retaining tendencies. So you might have some time to lose the weight, but not the hormones, because you have retained some water. Okay, doctor, please, is this session recorded? I would really like my husband to watch, please. So, yeah, so you have fans. Okay, I've had 3 cycles and 2 transfers in Nordica Abuja. The first was successful with a twin pregnancy, but I lost them at 21 weeks. The second failed, and the second transfer. I had serious cramps and it failed. I would like to know if there are tests I should do before trying again. Well, I don't think it's a matter of you doing tests. Well, except, okay, well, let's look at why did you lose pregnancy at 21 weeks? Very likely that we know that second trimester pregnancy loss is usually because of incompetence of the cervix. I'm not saying that that's what you have, but that is the commonest reason. But the fact that you are carrying twin pregnancy also might increase the chances. So one of the things we'll probably have to try to do is to make sure that probably the next time you have, especially if it's going to be frozen embryo transfer, that you have single embryo transfer, blastocyst stage, and then we'll see what that can. And of course, one of the good things which we are going to publish is we have very good success rate with frozen embryo transfer. So I think I'll just wish you the very best with that. I have premature ovarian failure at 37. I'm now 46. I've had 2 unsuccessful IVF and with donor eggs. I've stopped menstruating before. Is there any chance of success? The answer is yes. Mrs. Taiwo Iron Ajagbe. Yes, the answer is yes. Go to a clinic. Let's have you have a proper assessment, and then I'm sure it can happen. Is there any flexibility to payment? Okay, somebody's asking me whether there's any flexible payment plan for IVF. Yes, you can check our website. There is something called Nordica Flex Pay. You can see that, and then you can make use of that. And of course, also there are some financial institutions that are also giving you that you can pay instrumentally, but we can also do that if you want. I'm 52 years old now. Mr. and Mrs. Oladuni, I don't know whether there is the reason to keep you on, unless if you want to still contribute anything. So that if you have any other thing to do, I think you have done wonderfully well for us. And I don't know, if there is anything that they want you to answer, I can send it to you and then you can answer it.
All right.
Thank you so much. And I wish you the very best.
Thank you, sir.
Thank you very much.
God will continue to strengthen your union.
Amen. Amen. Thank you so much, sir.
Bye.
Bye.
Bye. Yes, I'm 52 years old now, married for the past 25 years, had 3 failed IVF, always at 6 weeks at the clinic in Lagos, and my residence is in Oyo Town. I lost interest in it and I'm not menstruating again. What can I do? Yes, you can do IVF, but you will need to use donor eggs. Let me be straight. If you are 52 then the best thing to do is that you must be using donor eggs. I have 2 different IVF in 2 different clinics, and I lost the embryo after testing positive, both with donor eggs. Is there anything my husband can do to improve our chances? Just thinking out loud. And can some in Enugu take treatment from Nordica? Yes, we have a clinic in Asaba. You can go to the clinic in Asaba to have the clinic, to have the treatment if you're living in Enugu. God bless the Oladinis. I'm encouraged. Can I have the Zoom recording? I need to share this with my husband. Fantastic. I'm sure we can do that. You can always watch it on Dr. Abayomi Ajayi, my Facebook page. So it's also there on my Facebook page. So you can always watch it at any time you want. Yeah, there's so many people who want to send the recording to their husband. Don't worry, just go straight to Dr. Abayomi Ajayi Facebook page and you'll be able to watch it anytime you like in the comfort of your living room. Yes, I still have a lot of questions there, but trust me, we are going to answer your questions on my Facebook page, since this is also shared on the Facebook page, but it will be sent to you in your inbox so that, this person is in the spirit. When is Nordica going to start running a full-fledged hospital? You are in the spirit. Flesh and blood does not reveal this to you. So, okay. I think at this point, I just have to stop. Like I said, we're going to answer all your questions. We're so grateful that you took our time to be part of this today, and we'll continue to try to be... and then let me quickly announce to you that on the 29th of November, we're going to be having my Dr. Abayomi Ajayi live, how to raise finance for IVF treatment. Because most of the time, one of the things we get is, IVF is expensive. IVF. Yeah, that's why I asked the Oladunis how they were able to raise money to do that. But all of us are not in the oil business. So, but I'm going to bring people to you also who are regular people, who have done IVF. One person, I think, did IVF about 17 times. And they have a baby to show for it. I think the second person just did it once. And so we're going to look from the different spectrum on the 29th of November to see how to raise finance for IVF treatment. It's at this point that I'm going to stop today. Thank you so much for joining us. And you can always, shoot us your question, and we'll be very happy to answer them to the best of our ability. Thank you very much for watching, and we'll see you on the 29th of November. Thank you.